Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Let's now understand the IBS, that is the irritable bowel syndrome. And the drugs used in them. So to begin with, first is in case of an ABD pain, there is nothing but the abdominal pain. So what happens with abdominal pain? First is you can give the antispasmodics. So you have something known as the antispasmodics. Next is the antispasmodics, the commonly used one is the diclomine. So this is the antispasmodics. Next comes the TCA variety. The TCA stands for the tricyclic antidepressants. So this includes the amitriptyline. So there is the amitriptyline as well as the imipramine. So amitriptyline as the imipramine. Next is the SSRI. So SSRI stands for the citalopram. So the commonly used one is the citalopram. So abdominal pain antispasmodics, that is a dicyclomine, tricyclic antidepressants such as the amitriptyline and the imipramine, SSRIs such as the citalopram. Next, this was in case of the abdominal pain, that is irritable bowel syndrome. Next is suppose the patients in case of diarrhea. So here there can be administration of opiates such as the loperamide. Next is in case of 5-HT3 antagonist, 5-HT3, and this is the antagonist. So here the example is the allosetron. So you have allosetron. Then comes the bile acid sequestrants. So we have the bile acid sequestrants. So first one was opiates, that is loperamide. Second one being the 5-HT3 antagonist, that is allosetron. Third one being the bile acid sequestrants, that is a cholestyramine resin. So we have cholestyramine resin. So all these are used for the diarrhea, opiates, 5-HT3 inhibitors, as well as the bile acid sequestrants being the cholestyramine resin. Next, moving on, we have the constipation. So in case of constipation, the classification of drugs is you can administer laxatives. So laxatives, you have the psyllium and the ipsabugula. So you have the laxatives. So here under the laxatives, you can include the psyllium. So you have psyllium as well as the ipsabugula. So psyllium and the ipsabugula husk, as well as psyllium and ipsabugula husk, and also the polyethylene glycol. So you also have the polyethylene glycol. Next is we also have the chloride channel activator. So chloride channel activator. So this chloride channel activator, it includes a lubiprostone. So there is lubiprostone. Next, moving on, there is a guanylate cyclase antagonist. There is also the guanylate cyclase agonist. So it is agonist. So this is the example being the linaclotide. So linaclotide. Then we also have the 5-HT4 agonist. So this is again for constipation. The 5-HT4 agonist is the tegaserod. So you have the tegaserod. And lastly the SSRIs, that is the paroxetine. So you have the selective serotonin reuptake inhibitors, that is SSRI, that is the paroxetine. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.